Okay, we'll make a start then. It is 6 o'clock and welcome to Adults and Health Scrutiny Review Board meeting. Can we start with apologies? Have we got any apologies?
Yes, I've got two apologies. Councillor Hussain, Pervez Sadiq and Kirsty Macmillan.
Okay, late items to be introduced by the chair. I haven't got any. Item 3, declarations of interest. No. Item 4, minutes of the meeting held on 13th of October 2020. Can we approve those? They have been circulated.
I'll approve them, Councillor Fareed.
Okay, thank you. Have we got a seconder? Can somebody second them?
I'll second them.
Thank you. Can we swap item 5 and item 6 around? We've had a request from people who are going to do the presentation. It suits them better that way. I'm quite happy to do that.
Councillor,
I'm okay with that.
Sorry to interrupt. Would it be possible to do the improving mental health item 7 first, followed by the Horizon Healthcare?
Yes, sorry, yeah. Item 5.
Item 7, followed by item 6.
Yeah, we're reversing the order. Item 7, 6, and then 5.
That's it. Thank you, Councillor Hussain.
Okay, no problem. We've got there eventually. Okay, can we get an update then? Health update. I think it's in 3 parts. So, who is going to go first?
Hi, Councillor Hussain.
It's a health watch, isn't it? Sorry, item 7. Sorry, go on.
No, sorry, Councillor Hussain. Yeah, thank you very much for rejigging the agenda for us. So I'm Mark Powell. I work for Derbyshire Healthcare Foundation Trust, so the mental health trust provider across Derby City and the County of Derbyshire. I'm the Chief Operating Officer at the Trust. I don't know if Helen wants to quickly introduce herself, and then I'll hopefully take us through the first part of the item.
Thank you, Mark. Good evening, everyone. Good evening, Councillor Hussain. I'm Helen Dillistone. I'm the Executive Director of Corporate Strategy and Delivery for the Derby and Derbyshire Clinical Commissioning Group. And we're working very closely with Mark and his colleagues on this development that we're bringing forward to the committee this evening. I'm also joined by Mick Burrows, who's the Director of Mental Health Commissioning, and between the three of us we'll talk to the paper and take any thoughts and questions at the end. Thank you.
Okay, no problem.
Okay, thank you. So I just wanted to briefly talk you through the paper that is on the agenda around some really sort of positive changes and improvements that we're seeking to make to our mental health inpatient facilities across both the city and into the county as well. And if you don't mind, Councillor Hussain, I'll just briefly talk to some of the key points in the paper and just work through it, and then invite Helen in and maybe take some questions at the end. So hopefully colleagues know that as a trust we provide the vast majority of sort of secondary care mental health services across Derbyshire, and as part of that we provide both inpatient and community facilities and services, as I'm sure everybody's aware. This particular paper focuses on some positive improvements that we're wanting to make with respect to our local inpatient facilities, so that's hospital-based facilities, and specifically relating to our acute units, which are there to provide care for individuals of what we call working age, so that's between 18 and 65 years old. Our two main facilities, we have one which is the Radbourne unit, which is based on the Royal Derby Hospital site, and also we have the Hartington unit, which is based at the Chesterfield Royal Hospital site. And the reason we're looking to make some specific improvements and changes to these sites is that currently they both are what we call provide care from dormitory style facilities. So that means that we have effectively large dormitory rooms that at times have 4 or 5 patients in them within a particular within the bays in those dormitory style facilities. And clearly this is not the best way to provide care for those individuals, and there is now national policy that is basically saying that all mental health providers need to ensure that the facilities are providing single rooms with an ensuite bathroom, and linked to that we should be providing all of our inpatient care within Derbyshire. So we still have a small number of patients that have to travel outside Derbyshire as well at this point in time, and this proposal seeks to address all of that. The current situation that we have is that we are one of those small number of areas across the country that doesn't meet the national requirements, and as part of the policy around this, there is funding available to support mental health providers to be able to provide single ensuite rooms, whether that is either refurbishing existing facilities, or in our case it would be re-providing the whole facility. And the reason why we'd need to re-provide the whole facility is that if we were to refurbish the Radbourne unit or the Hartington unit, there would be a significant loss of beds because of the space that would be required to create single ensuite rooms. So we have, as part of our planning, discounted those as options, and we're seeking to with colleagues regionally and nationally to develop business cases that effectively allow us to re-provide both the Radbourne unit as a facility and the Hartington unit onto a different site. The only particular specific issue in this paper is related to the Radbourne unit, particularly obviously for colleagues in the city and patients and service users in and around the city. And where we are at the moment is that we believe that there is a really positive option to re-provide and create a new facility on an alternative site. And one option that we have is that we would re-provide that on the Kingsway site, which is where I am now, but it would then be co-located with a whole raft of other mental health inpatient services that we currently provide, which are the vast majority on the Kingsway site. It would mean that we would be able to, consolidate services. We have the land here to be able to re-provide the particular facility, and in addition to that, we would be looking to develop a psychiatric intensive care unit, which is a more intensive level of therapy and support for patients with psychiatric conditions, also on the Kingsway site, so that we will be bringing all of those specialist services to get together. We're saying that no beds would be lost in this development. If anything, we would be increasing the beds slightly. So again, another positive step forward. And it would only be a small geographically distance change from the Royal Derby site to Kingsway. As we know, it's very close, and obviously there's other facilities on this site. We're keen to take this forward as quickly as possible. We are in the process of working, as I say, with colleagues from NHS England and NHS Improvement around the development of the business cases to secure the capital funding. I really wanted to bring it here today to talk to you about the process by which we engage our communities in this sort of really exciting development. There are some examples of what the facilities could look like in the paper, but obviously it's a great opportunity for us as a trust, but us as a wider sort of health and care system across the city and across the wider county of Derbyshire to build very sort of new bespoke facilities that would provide fantastic care for the people that we provide services for across the city and Derbyshire. So we think it's a really positive move, and obviously wanting to engage yourselves in this discussion about how best to take this forward in terms of that engagement with the wider public. So I'll pause there, maybe invite Helen in just to talk about the last bit of the paper, and then obviously open it up for questions.
Yeah, thank you.
Thank you, Mark. Yes, so in terms of the role of the Clinical Commissioning Group or the CCG, so colleagues on the call may or may not be aware that we're responsible for commissioning the services, and therefore we work very closely with the mental health provider for the services, and one of the key parts of the development that Mark has very helpfully and clearly set out is how we engage people in these discussions, and clearly how we involve yourselves as a House Overview and Scrutiny to help us shape the plans and to take forward the development. So as Mark has set out, this is an overwhelmingly positive development. We truly believe it will greatly enhance the acute mental health facility and provision currently provided in the city, recognising that there's no huge change in the service scope, and certainly no loss of service. Instead, we believe that local people will indeed benefit from a much better offer through much greater fit for purpose accommodation. But we recognise, of course, that we do want to work alongside current and former patients, their carers, service users, to help shape the development, making sure that the facilities are absolutely as they should be and can meet service needs going forward. So I'll certainly pause there, Chair. Happy to take any questions or comments that the committee has in terms of what we've set out so far. And I don't know, Mick, if you want to add anything from the commissioning perspective, if we've missed anything.
Just to add that I really support the idea in terms of least disruptive and maximum benefit to patients. Also, as Mark points out, everybody currently goes out of county for psychiatric intensive care support now, and this would bring that support together, and it would minimise the distressing travel time between the acute unit and a psychiatric intensive care unit that's any distance away. But obviously, the further they're away, the more distressing those travel becomes, and the more difficult it is for people to visit. So this really is a good way of consolidating all of our services in a modern way, rather than a make do amend and lots of upheaval, which patients would have to be. We would lose patients out of county whilst we did the renovations. So this does beat the best of all options in my view.
Can I just clarify? You currently provide services from 3 different sites within the city, and they'll all be brought to one site, yes?
So we currently provide, yes, from 3 different sites. We provide from Kingsway site, where I am now. We provide from the Royal Derby site, and we provide a couple of inpatient wards, or provide a service and 2 inpatient wards at London Road Community Hospital as well, which are specifically for older adults. So when I was talking earlier about adults of working age, this proposal here is specifically about those from 18 to 65. The people we have at London Road is over 65s. There are plans to try and consolidate those wards as well, but this proposal here isn't about the older adults. Councillor saying this is all about the reprovision of the Radbourne unit and the Hartington unit, so that's our acute adult service.
Oh, okay. And you also make some out-of-county placements. Do you know how many in an average year we end up doing that?
So broadly speaking, and sort of over the last couple of days, I can give you the numbers over the last couple of days. So we have anything around about 10 at the moment who are adults of working age. We would have 0 at the moment of adults of working age if we had single ensuite rooms. So it's a really good question, actually, because of the response to COVID, and because of what I was describing earlier about the dormitory style wards where we have 4 or 5 patients in those, and we're not able to use them for 4 or 5 patients at the moment because of infection prevention and control challenges around the COVID-19 response. So at the moment we are having to find placements for patients of working age out of area. As I say, if we had single ensuite rooms, we would have none at the moment. From a psychiatric intensive care perspective, so the more specialised, even more specialised care, as Mick says, we run with probably 10 to 12, maybe 13 people out of area at any one time, and the development of the PQ, as we call it, on site here would enable us to obviously eradicate those sort of out of area placements from a PQ point of view as well.
Okay, thank you. Has anybody else got any questions for Mark or Helen?
Councillor Froggatt has, I think.
Yeah, I think it's an excellent idea, to be honest, to put it all into one area. The only thing I have a problem with is people that are accessing on public transport. Yes, we've got access with the Uttoxeter Road and the Pelican Crossing that side, but if they're coming up off Brackensdale Avenue, there is no way to cross over safely. And the dog's barking. you know, on the other side, there is a Pelican Crossing right the way down, but on the Mackworth side, as I call it, there is no access because the lights there don't work. Plus, we've got all the A38 works coming. Will that cause any problems? And have you thought about asking Highways England if they will put some crossings in or a crossing in or something from one side to the other? Because you can only walk up the Sainsbury's side, so you've got to cross. Yeah,
it's a fantastic question, and something that we've been having a conversation today about both the implications of the changes to the A38, because clearly that's going to be a long period of time and quite disruptive, not least to getting in and out of the site, but also if we get to a point of having lorries coming in and out of the site as well, it's going to be quite problematic. So we've been talking through that today, and as part of the engagement that we would like to do with members of the public and other key stakeholders, I would see access to and transportation to the Kingsway site as being key things that we would want to talk to people about, and how we resolve those with people like Highways England and others as well. So definitely at the forefronts of our minds, Councillor Froggatt, yes.
Good, thank you for that.
I think the other thing, Councillor Froggatt, is the fact that the parking on the Radbourne site is notoriously hideous as you go round and around the hospital. We've got opportunity, and not for the people who are using buses, we can think about that, but the parking opportunities could be much improved, which I think is a flip side of moving the site a little bit.
Okay, anybody else? If not, if everything goes swimmingly well and there are no hiccups whatsoever, when do you think the whole thing will be completed, and when do you think you'll be up and running, the new service, the new site?
$1 million question. So the funding that is available, so there's specific national funding available for eradication of dormitories, and that's the pot of money that we're trying to seek the drawdown from. That needs to be committed and spent by March 2024. So we're talking 3 years from now. So that's a pretty tight timescale to work through all of the difficulties that we've just. Whilst it's very exciting, it's quite a tight timescale. So that would be our aim and ambition, to get the buildings operational by March 2024. There's obviously quite a lot to do between now and then, not least the engagement, as we say, with members of the public, and ensuring that we've got robust business cases, that we've got good value for money with the buildings as well, and then the sort of services. But March 2024 is the date we will be working to, Councillor Saying.
Okay, thank you for that. If there are no further questions, then I can say on behalf of the board that we are actually supportive of what you're trying to do, and I think it will be a major improvement to the services that are currently provided. But can I ask that, has you become aware of more details, please bring them back to the board as and when you feel it's appropriate.
Thank you, Chair. That was sorry, I did just pop my hand up just to double check with committee members how you'd like to be informed, but also how you'd like to stay involved, and the frequency of that. So certainly Mark, Mick and I can think about that outside of this evening's meeting and schedule something through yourself as chair and the secretary, but would welcome sort of your involvement and thoughts about how we continuously have the dialogue with local people about the issues that we've set out, but also to hear your thoughts and views as well as this programme develops.
I mean, ideally, once you've developed a detailed bid, which is going to be submitted to the government, we don't want to hold you back. If the timetable is or timelines are very tight, we don't want you to sit on those and miss an opportunity. But it is a case of, say, roughly speaking, three reports a year for now. Every other meeting.
Thank you.
We'll take it from there, because the next meeting might be in a shorter time scale, because once you put your bid together, would like to have a sight of it if we can. And then maybe just a quick update every other meeting.
Yeah, that'd be helpful. Yeah, more than happy to do that.
Once you begin to get close to the completion date, and we may need to change the frequency of reporting, but we'll consider that nearer the time in 2 or 3 years' time. But for the time being, I think once every couple of months, 3 to 4 months, about three meetings. Because our frequency is 4 meetings anyway, isn't it? For the board. So yeah.
Yeah.
Thank you. That's helpful.
Okay, thank you very much. Thank you.
Thank you, Councillor.
Thank you.
Thank you.
Bye-bye. Have a good
Mick
evening.
Burrows has got his hand up.
It was just a very quick one. Just
sorry,
my own benefit, Councillor. So you're very happy with us to proceed with the engagement and start to look at how we can develop this picture in the longer term, and then come back to you in a few months. You don't want us to do any upfront conversation about the idea. I mean, the idea is fine, isn't it?
Yeah. Yes, that's right. Yeah.
Excellent. Thank you. Just needed to clarify that for my regulator colleagues.
Okay.
Thank you for adding us up the agenda, Councillor Sane. Very grateful.
Yes, thank you. No problem.
Thank you.
Thank you.
Have a good
Bye-bye.
evening, everyone. Bye-bye.
Thank you.
Bye.
Horizon Health.
On to item 6 now, do we? No.
Yes, that's right. That's right.
I've got them in the wrong order. I hand wrote those. So item 6, according to your agenda papers.
Horizon Healthcare.
Horizon Healthcare, and we expect
Tina.
Updates.
Yes, that's right. Tina Hall and Jean Richards are here, and also Katie Hyde to give us an update.
Okay, then let's start with the updates, and I'll leave it up to you to sort out the order in which you want to come in.
Okay. Do you want me to start, ladies? Okay. So I've not done this before, so if I ask questions, forgive me. Okay. So my name's Tina Hall. I'm practice manager at Horizon Healthcare GP Surgery, Derby City Centre, with branch surgery in the Mackworth area. I don't know, has everybody had the information, I think the consultation and the briefing already, and been able to see that? Am I right in thinking that?
Yes, the information was circulated, yeah.
Yeah, okay. So is it more appropriate for people to ask me questions, or do you want me to sort of go over the history or review what's happening?
If you quickly take us through the salient points.
Okay.
And then we'll get to...
Okay. So we were 2 separate surgeries, Horizon. We were Wellside and Charnwood, both having branch surgeries in the Mackworth area. We merged or started working collaboratively a couple of years ago, and as part of that, we were looking at all our services in all areas, and then we suddenly had an issue with the branch surgery at Tufnell Gardens. The neighbour had done some building work, and it compromised patient confidentiality in the surgery consulting rooms. So they could basically hear patient consultations through their wall and also in the garden. So obviously we were concerned about that. We closed the branch immediately. We transferred services up to our other branch site on Humbleton Drive. And the idea was that we were going to undertake an auditory survey, which we'd got in hand, and see what we could do to put that right. Then a couple of the GP partners from Charnwood left, and they decided, long story short, to sell the property at Tufnell Gardens. It wasn't owned by the remaining partners, and that happened, and that was sold. So we were left with one single site, and the plan was to fully move all services there, to improve services, to look at other specialities going there. And then unfortunately COVID hit. So we then had to revisit the risk assessment, and unfortunately that practice site wasn't fit for infection control purposes to carry on seeing patients, and we also needed a green site. We had shielding and critically extremely vulnerable staff who needed a place to work, and we decided that they would work also from there. And we have then transferred all our services pretty much to our main site on Burton Road in city centre. So the original issue was the closure of Tufnell Gardens, which we were considering as part of the merger. Obviously that was taken out of our hands. The greater picture is around COVID and returning services to our branch surgery, but also the fact that there are issues within the Mackworth and Mickleover area for healthcare provision and for other GP surgeries in our area, something which is currently under consultation. There's an options appraisal underway, which Katie and Jean are aware of. It's not currently in the public domain. So, yeah. Is that enough information for everybody?
Diane, you raised your hand.
I think Adrian was actually before me, was you?
Oh, sorry.
We might have been together, Diane.
Can I go first then?
Yeah, why not?
Okay. Tina, I notice on the appendix that people are having their vaccinations outside at Humbleton.
Yes.
Have you not thought of asking the chemist on Prince Charles or approaching Derby City Council or, oh God, who runs the library now? The library, to see if you could use the library to save people going outside?
I don't think it would be, it wouldn't be appropriate for infection control and IT purposes, because we need access to our clinical system.
So I know the pharmacy are looking to try and start doing the vaccines.
Yeah, I mean, the vaccines that we had outside, we wanted to bring flu to Mackworth, and we saw that other areas and other practices were doing things outside, and we thought, you know what, actually, we buy a gazebo, we get it set up, we can make that work. So that's what we did with the flu vaccine. But that was quite straightforward because we had 1 minute appointments. It was bang, 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 and everybody was through. So yeah, we're not getting any COVID vaccinations anytime soon in practice, unfortunately.
Well, that's a shame.
Yeah.
Yeah, but you're not the only GP practice either that's having this problem.
Yeah, no. If at all. I mean, I don't know whether local pharmacies, and maybe eventually we will, but at the moment it's not in sight. But it would be nice,
yeah,
to do something collaboratively, because there are a lot of people in Mackworth and Mickleover that don't. It's a long way to go to the arena, isn't it?
Yes.
So it's a great site. It's a great setup. If you haven't been, I've been working there as well, and it's absolutely amazing what they've done. It is. It's still a long way from Mackworth. Yeah,
but there are sites in Mackworth that could be used. You know what I mean? We have a lot of a lot of buildings that could be used for the vaccines. I believe
that there was some work going on in the background before they chose the arena site. They were looking at things, but we were a bit out of the loop, if I'm honest. So.
The process for having sites approved is very complicated. So I think that's why there only is certain places for now. Yeah.
Adrian.
Thank you. Whilst I appreciate you've invited the councillors to meetings and discussions, which I'm very grateful for. From your survey and from what I'm hearing, that there's a general perception or whatever of dissatisfaction with the level of service that you're providing for the residents of Mackworth, and I'd really like more detail on how you plan to tackle that. All right, I appreciate COVID's got in the way and that will have a major impact, but I think some residents do feel they're being a bit let down and not having provision within Mackworth. And going forward, I'd like, could you just tell us how you intend to address that and resolve it going, in the future?
But the practice is we're currently working on making the branch surgery COVID secure. There are some works that we need to do on that, and I'm working with Jean, and we hope to have that done quite soon so that we can restart safely our services from the branch surgery. We do appreciate, there's a fifth of our patients in that area, and we do appreciate that you must miss the service. I must admit, not that I want to elicit many complaints, but we haven't had many complaints. So I want to say if it wouldn't make things go any quicker, unfortunately, but we're not getting that feedback in practice.
That's reassuring. Thank you.
I can't see any other hands up. So can we go to Jean then for your update, Jean?
Yeah, so really just to add to that, and it is in the paper that we are, as Tina said, we've done a primary care estate strategy for Derbyshire, which highlighted actually the Mickleover and Mackworth area is the number one top priority in the whole of Derbyshire in terms of primary care estates. And we have already undertaken a feasibility study and worked with the local practices in the area on potential solutions. And those have been narrowed down. There's certainly no intention that we won't have a building in the Mackworth area in future. So it may be that it won't be the building that you've got now. It may be a new building, but the intention it certainly isn't that we won't have provision in the area going forward. So the next stage will be to undertake a business case, an outline business case, to look further at some of the options and to work out what's feasible, and obviously to do some engagement with patients.
And we are fully engaged in that as well. Sorry,
go on.
I said we are fully engaged. We're involved in that. We're around the table. It's key to us. It's very difficult. We don't own the other building either. So we're at the mercy of landlords at any one given time. It's not really suitable to expand upon. It's a very small 1920s semi-detached house that's been converted, so it's really not fit for the future. So we're really keen to go forward with what's happening in Mackworth, and we want to be involved in it, and we'd be happily leading it if that was an option for us as well.
Conor Froggatt, you got a question?
Yeah, I mean, obviously the Humbleton Drive site is not fit for purpose at all. It's a semi-detached old 30s building. In our neighbourhood board fund, as Adrian will also tell you, we have a pot of money sitting for this exact thing. We want a medical practice on Mackworth, and the money from Section 106 is sitting there, and we're running out of time to use it. and we need that money spending on a building for medical purposes in Mackworth. And if we don't use it soon, we will lose it. So, you know, can we really get something started here?
Yeah, I'm hopeful that we will. Obviously, very difficult times at the moment for everybody involved, but I'm hoping that we will start the outline business case in the next kind of few months, very, very soon, certainly, so we can get that moving. Yeah, and I'm conscious there's quite a lot of Section 106 money going to become available, that we, not just in this area, but in other parts of Derby City as well, we need to utilise. Absolutely. Yeah.
Okay, any more questions? If not, can we go to Katie?
Sorry, Councillor Hussain, I hadn't got anything to add. It's just that Sean Thornton had asked me to just come to the meeting in just in case there was anything you wanted feeding back. So I'm just here in an observatory capacity. Is that okay? I'm so sorry. I've been set up for something I'm not delivering, so I do apologise.
Okay, no problem. Well, in that case, can I thank you for the updates? And we're only required to note the report. There are no decisions to be made on these items. So thank you very much.
Okay.
Thank you for your attendance.
Okay. Thank you.
Everybody.
Thank you.
Bye.
Councillor
Thank you.
Flores, I'll be in touch with you with regard a link for our PPG meeting very soon.
Yeah, looking forward to it, Tina.
Yeah, likewise.
Okay.
Thank you.
Thank you.
Thank
Bye.
you.
And now we need to proceed to item 5.
That's right.
And I've got Peter Moore, Mike Goodwin, and Clive Newman.
No,
Those are the names that were sent or were against the reports.
This is for the health. This is for the Health Watch Derbyshire report, and it's a lady called Helen Spores.
All right.
Helen.
You're like Helen Henderson.
Helen Henderson Spores. I do
anything.
apologise.
Yeah, that's
No,
fine.
I forgot your middle name.
Just call me Helen. It's easier.
Thanks, Helen. So you're here to present the Health Watch Derbyshire Care Homes report, aren't you?
If that's all good with you, if that's a good
Yes,
time.
that's fine. Yes, please.
Put that onto the agenda now, then that works really well. So
thank you.
So first of all, thank you for having me on the agenda tonight, and really great to be able to present to you the findings of the piece of work we did, because I think a lot of the findings that we came across connect really well across the city and the county, and it's really good to be able to share kind of some of that learning and some of the experiences that we collected in the last part of last year, just to give you as a council a bit of insight around what it was like to be perhaps in a care home, or to be a friend, family or carer of somebody with somebody in a care home, and just to give a little bit of kind of understanding and insight. So that's the basis on which we share that report. And that, I suppose going into COVID, we talked to a lot of our volunteers, and I think a lot of them were really keen to share with us their kind of understanding and their experiences around what it was like to have somebody in a care home during that period, and to try, I suppose, 2 parts. One was to kind of get a feeling around their physical and mental well-being of the kind of care of the resident in the care home and their relatives, and also what measures had been put in place from the care home, to try and work through that in clearly really difficult times. So we did a piece of engagement, but in a very constructive way, to try and think about what had been positive, what had worked, and and essentially to try and share best practice between care homes around what had made most difference. So we launched this at the back end of last year, and we got 90 responses. And not everybody named the homes that they were talking about, by all means, but 45 people did name homes that they were talking about. Only 7 of them were from the city, and the rest were from the county. But I don't know. I still feel that the themes, the trends, and the sentiments that they shared, it's still useful to share with you guys in terms of how people felt at that period of time, and therefore how that can be used kind of going forward in terms of managing this really difficult time of how to support people in care homes, and how to manage that really difficult conflict between the need for interaction and managing risk, basically, which I think people know and understand, but that's really difficult for friends, family and carers to, and for residents as well, to kind of understand and put that into context. So yeah, I think the main things that came out from the work we did was around visiting and trying to kind of maintain that as much as was possible, but obviously in the context of the environment, and realizing that's not always possible or safe or appropriate, and that does have a real value, but equally recognizing that that's not that's not always possible. So like, out of that were 90 people that responded, 37 of them said that they felt that their kind of welfare had become worse during the pandemic because of missing contact with their friends and family, and but that homes have equally worked really hard to try and maintain that, and they've come up with creative kind of solutions around appointment style solutions and that kind of thing, but that there was that real kind of gut feel that kind of people are missing that. The other thing that came out, which was quite interesting, and obviously this is all in the report that you've seen in as part of the pack today, was around kind of telephone calls and essentially how that they're great for residents that have got their own phone and who could use that independently, and other people found them unsuitable when their relatives were unable to hold the phone or had got sensory impairment. So I suppose, Bill, it's about having different kind of tailor-made solutions for different residents depending on their own personal needs, I suppose. Is one thing we found, that that one size is not going to fit all. It's about being creative and being responsive to the needs of the individual in the care home, to try and give them the best mechanism for continuing to be in support of their in contact with their relative. We had literally a caller today where the resident is on the top floor of a care home and has been offered a visit to their family through the window. We're like, but we're on the 4th floor. so there's a bit of common sense stuff around that, of how is that a visit? It isn't. So it's just trying to, and I think the other thing, everyone is really grateful, appreciative, and knows that care home staff are absolutely moving heaven and earth to do the best they can, to be supportive, to, you know, and there is nothing other than complete respect and complete admiration for what staff members are doing in this regard, and that is really clear in all the work we've done. And I think that's crystal clear, absolutely. And there's something to really be proud of, I think, for, you know, the local authority and whatever. Is that really is that's there, but equally, yeah, there's those bits that are around having a, you know, being able to see your son or a daughter and your social visit is from the 4th floor, which is don't quite work. So yeah, but that's so it. But I think everybody recognises and understands it's really difficult times, and it's challenging. Every home, everybody is trying to work in different ways to help try and manage risk and look after people in the best way they can, and manage that kind of interface between social interaction and risk, and they're doing a great job of that. And that isn't always easy, and that isn't always straightforward, but you know, there's an awful lot of hard work going on in that. So I suppose moving on from that, and it's quite interesting in a way that some of the themes, so like moving on to communication, I think like some of the things that we always used to pick up pre-COVID as an organisation around people's issues or complaint, that they're actually the same now as they ever were in COVID times. People want to know and understand what's happening and why, and they want that understanding, that kind of patient experience, that interface and understanding. And that is, so I don't think the issues have massively, from our experience anyway, the issues haven't changed around communication, understanding. They're the same. They're the same issue. They've changed because they're through a COVID lens slightly. They are slightly different, but there isn't a whole raft of different patient experience kind of. You know, do you know what I mean? There isn't a whole load of different scenarios that are creating a whole load of different angles around patient they're the same ones. People want to understand what's happening. They want to know what's happening to them and when. They want to get who they can talk to and when and why. And they want to understand what's happening to them. And that's no different, frankly. Now, in COVID times, or 6, 9, 10, 12 months, it's the same. So there is absolutely nothing different around the patterns, the trends, the themes that we're picking up as an organisation around kind of patient experience, communication, etc., that we haven't picked up before.
Fundamental needs of the patient actually
Sure.
remain the same, but in difficult times, it becomes more difficult to live up to the expectations that people have service providers. And in a sense, at this difficult time, it's difficult to take a snapshot to see whether or not providers were able to live up to the expectations of the people that they were providing services to. Because families were struggling, service users were struggling, providers were struggling. And in a sense, your task was quite difficult in that sense, to get a sense of where the providers are against when you look at against what the service users' expectations are. They want to be treated with respect, they want timely responses, and they want staff and providers to be generally very sensitive to the needs of the people that they're caring for.
Yeah, no, and I think you're absolutely right, and I think I completely agree, and I think people equally that we've spoken to are very, very mindful of the fact that the system is under a lot of pressure, and I think people know that generally and understand that and are very sensitive to the fact that we're living in exceptional times. But I think in terms of the themes, and I can only comment on this based on the people we've spoken to, but I think from our perspective, the things that continue to be most important to people is basically knowing what's going to happen to them, who's going to do it, why, when, and understanding what that's all about, and having that degree of understanding and trust in a process. And that has not changed in terms of COVID or pre-COVID. I think that's really continues to be a really important theme for people around their kind of COVID or pre-COVID experiences, is having that general knowledge, understanding, trust, and communication with the professional that's leading their care at the time.
Yes, absolutely right. And as you can see from the statistics, nearly 1/3 of the total deaths that have happened because of coronavirus have happened in care homes.
Yeah.
So it's been very stressful time both for people who are being cared for in care homes and also their relatives and their loved ones. Because they've been on tenterhooks in terms of not knowing whether their loved ones are going to get an infection and are going to get into difficulties.
Yeah. And you're absolutely right. And I think that's why we were keen to do this piece of work, to just try and understand a bit more about what that's felt like to be a friend, family carer of somebody that's in a care home, and to try and unpick that a little bit. And you're right, it's been clearly a really challenging and difficult time. But I think I think the main things that have come out of that is it's great to have good lines of communication, and great to have good positive channels of communication, even if you can't see your loved one in the same or the normal way because of restrictions around visiting. And it's just great to have that trust between the friend, family carer and the home, so that they've got that really positive interaction, so it doesn't feel like it's disjointed, and it feels that there is that which is really difficult to create, and it's really difficult to maintain clearly at stressful times. But so
thank you for
we did the piece
I think we picked up quite a bit. Are there any questions from anybody else?
Yes, please.
Yeah, Diane?
Yeah, I'd just like to say I think the care home staff have done absolute wonderful things during this pandemic, and I have just been through that with the visitation, etc., but I'll bypass that. But what the actual problem here is communication.
Yeah.
If a resident has the mental capacity to hold a phone and make a phone and talk on the phone, not a problem. It's when the mental capacity isn't there. And then what the problem is then is there isn't enough staff. The staff are paid minimum wage, and the homes are run to make a profit. Let's face it, they are businesses. They are to run a profit, make a profit. So basically, they haven't got the staff to keep running up and downstairs and standing holding the phone on speaker for a family member to speak to them, or on FaceTime or whatever. So if we can get something sorted that they get more wages, or they can apply for more staff in these circumstances, then, you know, you would be able to ring up and say, can I speak to my mother? Can I speak to my father? But if the staff isn't there, it will never happen. You know, they've got to employ, things have got to be altered so that the care homes aren't just run on a profit basis as much as it is now. They have to actually say, yes, if we have something like this happens again, we do have the staff, or we can get the staff in to say, yes, I will be on the phone monitor. I will be phoning the families up and communicating. But this is what it boils down to. It's lack of communication between families and the care homes. And that's what it is.
I agree with you. Any more questions? Any more observations? Before we go on to the next item, I think Diane has raised a very good issue here, but the problem is, because I've actually been involved in this sector professionally before I retired for quite a number of years, the main problem is, for the last 15, 16 years, the additional the fee levels have only risen by, in most authorities, by the rate of inflation, and yet the type of people that the care homes are now catering for are increasingly becoming more and more dependent, requiring more staff attention. But the care homes would say they haven't been given enough money, so it's a circle that's been created now, which is quite difficult to break in a sense, because care homes will say, we don't get enough money from local authorities to be able to employ more staff and remain profitable. Local authorities will say they're not getting enough money from the government to be able to offer higher salaries and better conditions.
Yeah, sure, and I understand that, and I think my perspective as a chief exec of Health Watch is to talk to the patients, the people, the friends and families that are in those homes, and have people in, and have friends and family members in those homes.
I'm not talking about your specific role. I'm just answering Diane's question.
No. I'm just saying that around different perspectives But I can completely see what you're saying, and I get that. But it's just representing those different angles, isn't it?
No. I mean, I'm not defending care homes. We should be actually getting the best we can out of them. All I'm saying is, if you've got a staff ratio of, say,
I see that.
9 patients to 1 staff member.
And
if they're heavily in a care home, I mean, I think the staff ratios are narrower. It's like 3 to 1, 4 to 1 in the nursing home. But anyway,
I see that.
But thank you for sharing that information with us. It's been a full discussion anyway, and it's an item for noting. So can we note it? Now we've got Alison Parkin. That item hasn't been put on the agenda, but Alison, it will be good if you could take us through the amount of money that we've been spending from the, we get 3% council precept set aside for being invested into social care. And I think you undertook to take us through the details to make sure that the council has been spending at least 3% for the last 4 or 5, 6 years.
Yeah. Hi, good evening, everyone. There's a report, I think, on the agenda, isn't there, that illustrates the social care funding.
Yes, there is. I've circulated the agenda and the correct agenda, and you should all have received that.
There's been a mix-up with the agendas. I printed a different one. Diane is struggling with something else. So the agenda that I've been operating from is actually completely inaccurate. So if that is already on the agenda.
Yes, Councillor Hussain, I can confirm I circulated the correct agenda for the meeting. I don't know quite what the meeting, and I've circulated
this meeting was all over the place as far as I was concerned. I'd be looking for the things in wrong.
Okay, so the report that's on the agenda is really it sets out the context and gives a summary of the different elements of social care funding into the city. So that's the report that's on the agenda. So I can take you through that report, and then obviously if there are some other questions that you want answering over and above that, then that's absolutely fine, Councillor Hussain. So what the report really illustrates is first of all that the demands on adult social care funding for the City Council are quite significant. It's one of the biggest spending areas that we have within the City Council. It's probably around about 48% of the council's budget. So it is a significant resource for the city. We do know that there are pressures outside of our control, which are driving demand across adult social care, which have probably been well rehearsed at this committee previously. We do know that the over 85 population is rising by about 3% per year. And in 2017-18, there was a 10% increase in the numbers of adults of working age with severe and chronic learning or physical disabilities. And we do know that we are long awaiting a sustainable funding model for social care. It's been on the national government agenda for a number of years, and it probably feels as though that sort of solution is long awaited. Just in terms of the national funding position and the national context, as you can imagine, the COVID-19 pandemic has had a very, very significant impact on public finances. There's some details within the report at 4.1 that shows you what the national borrowing figures will be in 21-22 of 394 billion nationally, which was compared to 55 billion in March. So you can see that the demands on the national context on public funding is very, very significant. In November of last year, the HM Treasury announced the comprehensive spending review for local authorities. Within that comprehensive spending review, it assumed a 4.5% core spending power for local authorities. And then within that 4.5% core spending power, there was an assumption that councils would raise its council tax by 4.99%. At 4.3 within the report, you can see the complexities of adult social care funding for the City Council. It's made up of a myriad of different funding sources. As you rightly said in the introduction to the report, we've got the adult social care precept, which is a fairly new concept over recent years that allows local government to be able to raise additional precept on its council tax for adult social care. We've been given specific grants over recent years, but I suppose the most single largest contribution to the social care funding envelope is through the Better Care Fund, and the Better Care Fund has different elements that exist within that, but that is a significant tranche of funding. All those elements of funding, whether it's the adult social care precept or the Better Care Funds, total around £27 million into the City Council to support adult social care funding. So you can see through that table that the precept is only a small amount of revenue funding that is attributable to adult social care. What we would say in regards to how adult social care is funded is that there's no national government budget for national social care in England. The public elements are financed through local government funding, and that funding is a combination of resources that are given to the local authority from the funding elements that I've identified, and also allows a local raised revenue from business rates, council tax, and income from fees and charges. There is no hypothecation between the funding elements that are generated from all those funding streams and the amounts that are actually spent on adult social care. And just for clarity, in terms of the precept, because I think that was one of the issues that you were particularly focused on this year, the adult social care precept for 21-22 would have raised just short of £3 million of funding for the City Council, and the adult social care budgets in 21-22 are increasing by over 4 million, 4.2 million in total. But I must clarify that obviously, whilst your focus is on that precept, the amounts raised through the precept and the amounts in the adult social care budget, there's no legal requirement in terms of hypothecating that increase through there. So that's the details of the report that's on the agenda, Councillor Hussain. I'm quite happy to take any further questions or clarification.
Thank you, Alison. Excellent. Have we got any questions for Alison?
Yes, please.
Yeah.
Me again.
Yeah.
Just to note that we are £1 million basically short on care funding packages. Yeah.
£1 million short.
Yeah, you said we're so much from the precept, 3.5 million from the precept, 4 million.
The growth, so we've actually put more into adult social care budget for 21-22 than the additional amount that you could generate through the precept.
Yeah. Do you know where actually does this other money come from? Is it from the government, or have we moved it from elsewhere in the council?
It will be done as part of the total finance settlement, so it would have been raised through council tax in general, through business rates, through efficiency savings as a contribution from directorates. So it's all done as an amalgam in terms of that. So I suppose it would be a combination of all of those things that would set the adult social care budget for next year.
But for this year, at the moment with the COVID, anybody accessing residential home from hospital or home with COVID, there is a COVID budget so that they don't pay. We actually, the government pays.
Yes, so that's absolutely right. So at the beginning of the pandemic last year, there was what we had called a hospital discharge scheme, which was national funding alongside lots of other funding that was attributable to the pandemic, but this one was the hospital discharge scheme. And what that did is, rightly, as you said, Councillor Froggatt, is that anybody that was discharged from hospital into social care accessed the hospital, was funded by the hospital discharge scheme. We are now going through a process of assessment. Obviously, that's not a sustainable model. Those individuals need to go to their I'm going to say the right home, but I don't mean home as in a physical bit. I mean in terms of the responsibility, whether that's health through the continuing healthcare assessments or whether that's social care. So we have, I think, a deadline up to about the end of March this year to be able to go through that assessment process, do the financial assessments, and business as usual, really get to that business as usual position. But yes, you are right, there has been additional funding to support that discharge through the pandemic.
Thank you.
Okay.
Any more questions to Alison? If not, can I thank you, Alison, for bringing us up to date with everything. Thank you very much.
It's a pleasure. It's a pleasure. Good evening. Thank you.
Thank
Bye.
you, Alison.
The last item, item 9, is topic review.
There is, sorry, Councillor Slane, there is another item. I know you seem to be working from the wrong agenda. I don't know why, because I did send you the correct agenda. So we have the work programme at item 9, and after that we have an item 10 for information, access to GP surgeries update. That was just for anybody to ask any questions. Questions can be circulated to the officers who provided the report.
I've not got in front of me the agenda that you sent me this evening, which is now, I brought it up on my phone because I don't know how to bring it up on the laptop at the same time while I'm still communicating. So I'm operating on 2 systems now. I'm looking at the phone.
Right. I just don't want you to miss anything. That was all.
Yes, no, I did notice that there is, but item 9 is actually topic.
The work programme. Yeah, that's correct.
there is nobody here to talk on it apart from me. If I could bring the rest of the board up to date with it, we were hoping that the topic review, which we have adopted at last meeting, was to look at how the impact of COVID on our care homes and our staff, and also the impact on things in general, maybe even the economy. But basically, we were looking at impact on service users. That's where the focus was going to be. And I was hoping that by the end of this financial year, we'll be well out of it and we'll be in a position to reflect back on what had gone during the pandemic and whether we could have done better, whether there were missed opportunities, whether there were scope there for us to do things differently and provide a more responsive service or robust service to our service user. But because we are still in thick of things as far as the pandemic is concerned, so I think it was best to actually put that off. Instead of dragging staff here to come and talk to us and giving reports, they are all working on vaccinating members of the public because they've been set very demanding targets. And the request was that we put this off until we have more or less overcome COVID, and then we can begin to reflect on the previous just over a year, because it's difficult to start asking questions while we are still tackling the fire, if you like. So we need to put the fire out first before we begin to look at our practice and reflect on our practice to look at improving things for any future such event. So the topic review is going to slip into next year inevitably because I don't think we'll have fully overcome the pandemic in the next 2 or 3 months. And that was just to bring you up to date with where we are with the topic review. Diane, yeah?
You just make a comment on the care homes. Only I have been talking to managers of care homes plus the staff as well, and what I'm finding is because they've all had the vaccinations, the staff have had vaccinations, there is like a huge relief, and the staff aren't feeling as stressed. So, things are moving forward with the staff and the residents. They're a lot happier because they've had the vaccines, and I think they're all doing a great job. Just to let you know.
Yeah, I think statistically, there may be an odd person who's still not had the vaccine, but most people in care homes have now had the vaccine. There must be a good reason for someone who's still not had it. Because the focus is now shifting towards people who are in their 70s, isn't it? They're calling people in now. And those people who are under 70 but have got additional vulnerabilities are the next target. Well, we just keep our fingers crossed and hope that we can overcome this nasty disease, which has made our lives misery. That's all I've got to say on it, unless there are any other comments from anyone. We go on to item 10, which is general practice, as Lindsay was saying. It's just an update. And if you had a chance to look through it, do you have any questions? If not, it's just for noting anyway. I
think it is what it is, Fareed. There's not a lot that we can do about it, so it is what it is, and see what we can do in the future.
Yeah. And that brings us to the end of this meeting. Thank you very much for your participation, your comments, and your